Welcome again, Rotarians, and happy to talk to you today. And we have two special guests who are on the screen from the SVMC Development Department. Leslie Keefe is VP of Development and Communications at SVMC, and her associate, the very talented Maria Garay. And let me say this, if you're involved in a capital campaign, the level of expertise and energy and effectiveness of the hospital development department is beyond belief how great they are. It makes it really simple. Mike McKenna and I pretty much were along for the ride on this thing with their outstanding support. And we're really lucky to have not only the hospital, which is world-class, but these folks too, who are making a tremendous difference for the community and the hospital as well. Go ahead, Leslie.
No, very kind of you, Dave. Thank you so much. And it's so nice to see everyone. Thank you for allowing us the opportunity to be here today. And let me just disagree with Dave for a minute. Dave Newell and Mike McKenna, their leadership and their passion and their expertise leading this campaign and their dedication to this community is outstanding and really second to none. And it was such a joy working with them. So thank you again for having us. I do have a couple of slides that I'd like to share. Dave, you tell me when you would like to.
Yeah, go right ahead, Leslie. That's fine.
Marie, would you like to say anything before I share and introduce you on the?
No, I just wanted to sort of echo what you were saying about Mike and Dave, and it was wonderful to work with them. And I've learned a lot more about the community, which is wonderful for me. So thank you to them, and thank you to the Bennington community for everything that they've done to support this fund.
Thanks, Marie. So let me share my screen here. There we go. So Dave, I'll let you start, and then I can jump in whenever. I've got two slides here for you.
And that's a great one. You're looking at Hunter Hall and the beautiful SVC campus. Let me give you a very quick background on this, and I'll turn it over to Marie and Leslie to talk a bit more about the campaign. It's no secret to you that the college closed in May of 2019. Very difficult time for the community. Morale deflator for all the hundreds of alumni who live in the area and those who use the campus and the trails. We lost 75 full-time jobs, faculty and staff. We had to transfer the nursing program away from SVC to Castleton State and the radiological tech program to Massachusetts College of Liberal Arts and the faculty. The administration all left. So what was left was the trustees, of which I ended up being chairman. And we had the job of dealing with the aftermath of this closing. Let me say this, being on the board of a college that closes is an overrated experience. And it was like nothing I've ever experienced from a nonprofit volunteerism standpoint. There were two local trustees, myself and Carol Conroy, who used to be director of nursing at the hospital. And it was our job to sort of attempt to steer the ship with what was left, which included trying to market the campus, dealing with the lawyers from the lenders, our own lawyers. We had two directors and officers lawsuits filed against us. We had to manage that. And what was left was this beautiful campus that you see here, the Gatehouse, which is right on Monument Avenue, and then the Arts Center out on the West Road for the properties we owned. During the time from May of 19 all the way till December of last year, 2020, we had 3 purchase and sale agreements on the campus, all of which fell through, all 3 of them. We were forced into bankruptcy in September of last year, at which time the trustee took over. And there was an auction, as you well know, which is well publicized in December of last year for purchasing the campus as well as the Gatehouse. Shortly after we did file for bankruptcy, the hospital stepped up and Tom D contacted me and said, we might be interested in looking at the campus, and certainly we were thrilled to hear that news. And due to the outstanding leadership of Tom and his executive staff, they put together a coalition of support and got agreement from the hospital trustees to take a run at the campus. And it did go up for auction, and the hospital boldly stepped up, and it was a bold gesture on their part, and came up with $4,650,000 to buy this campus. And now they've got it, which is just an outstanding contribution to the community. And having that, as you see, the beauty and the great resource that it is in the hands of a local institution is a priceless thing for Bennington, a game changer, I think. So that's where we are now. And I'll ask Leslie and Marie now to talk a little bit about what we did from there on the campaign.
Thank you, Dave. That was a great overview. Very shortly thereafter when we acquired the former Southern Vermont College campus, it was actually David Newell's brainchild. He approached Tom D and said, I think I can create a fund and start a campaign and help you offset some of the expenses, because it wasn't in our budget. It wasn't in our strategic plan. It wasn't something we were anticipating. But the trustees and of course our executive management team, which I'm a part of, felt so strongly with Tom's leadership. He'd been thinking about this. He'd been watching what was going on at the campus. He heard from many community members. He was watching the direction, and he felt very strongly we needed to step in, because who else was going to do it? So that's the background, but it was really David's idea. And we contacted Michael McKenna, who's on our foundation board and chair of our annual fund, and the two of them teamed up. And I will tell you that in all my years of being in this business, I have never, ever experienced such a grassroots campaign such as this. The outpouring of support that has come from this community has just been so heartwarming. Donations from $5 to $200,000. We had a $200,000 anonymous gift. So the fund right now is at almost $640,000. As I said, it's in the range of $5 to $200,000. If I could share with you the scores and scores of notes that we received, as I said, I've never seen anything like it. It was tremendous. And nearly 77% of the donations came from Bennington, which I just found just remarkable and so incredible. This community stepped up in big time, and just goes to show how important the campus is to the community, and the fact that the community has access to that campus, whether it be the trail system or fields or whatever, but also the support for the hospital. And it was, as I said, like nothing I've ever experienced. And we David and Mike said, 500,000, 1 month, let's get it done. And we exceeded that goal. And I will tell you that every penny is needed, and then some. As I said, the 4.6 million wasn't something we were counting on having in our budget. And that does not include the maintenance of this incredible facility. A lot of deferred maintenance in that space. And I'll let Marie chime in, but I can talk a little bit about where we're going and what's happening with the campus now. We're going to keep the community updated. But Marie, you want to chime in?
Sure. I think one of the first uses of the property obviously has been the vaccination clinic, which has gone off really, really well. And in a meeting yesterday, Tom reported that it's one of the best run vaccination clinics in the state. Bennington County is leading the state in the number of vaccines that have been administered. I think we're at 59% for at least one vaccine. So it's been a tremendous, right away, a tremendous asset to the community. And I know there's a lot of conversations and talks going on with the town and with others about how the property can be used to attract people to the town of Bennington, so that it will be, another economic boost, we think, for the town, as well as an asset for the hospital.
Absolutely, and thanks for that lead in, Marie. I think many of you may know Brian Lent. Brian Lent was with Peckham Industries for many, many years. He knows many people in the community. We're very fortunate to be able to hire Brian to be our full-time project manager, but we are working with BCRC and of course the town, the land trust, looking at the trails. Some of the uses that we're considering, it's going to take months to put a long-term project together, but certainly workforce housing is something that is critical need in this community. Childcare is another one that is critical need of childcare. There's a tremendous shortage. The other thing is we've been talking to Dartmouth Hitchcock about creating a primary care residency program here at Southwestern Vermont Healthcare. Where there's a shortage of primary care physicians. There has been for years. And we think there's an opportunity to be able to create that program with Dartmouth here in Bennington and have us be the training center. So those are just a few of the things that we're researching. As I said, it's a heavy lift. It's a big plan. And we're seeking lots of community input. And there will be opportunities for communities to we will have forums that people can come to so we can update them. And we're really going to start a whole series of communications just around the Grateful Bennington project and the fund, and let people know what their funds are going to, and keeping people updated on the plans moving forward. But Dave, you want to add anything to that?
As you well know by reading the news, there were 4 colleges in Vermont that closed about when we did. SVC, St. Joe's in Rutland, Green Mountain, which is in Pulteney, and Marlborough. And I think the result we had on the campus transfer to the hospital was the best of any of them, I think, for a long-term benefit to their communities. And our hospital is not only clinically outstanding, but they understand the larger view of that health is not just clinical health and medical health, but it's community health. Again, evidenced by this great purchase, as well as the Putnam project before this. The hospital stepped up significantly to make that happen, which, again, another game changer for Bennington, in my view. Wouldn't have been possible without Tom and the leadership team finding a way to help invest in that. And the hospital will have a presence downtown. So the institution is truly the backbone of the community in many ways.
Thank you for that, Dave. Yeah, just to add to that, we talk a lot about population health here. It's part of our strategic plan. It's the way health systems are looking at community, at our patients. You can't have a healthy community without a healthy economic base, and we need, and Tom's been laser focused on that, as Dave just mentioned. Tom D is one of the most humble, incredible leaders I've ever had the opportunity and honor to work with. And he'll never say it, but he's the driving vision behind a lot of this. And he's just an incredible person. And he's brought together a great team of leadership and clinicians. And I could go on. We don't have enough time to say all the things that are happening here, but certainly we are humbled to be here. It's an honor to take care of this community. And I think this project, as Dave said, is another game changer. And I think Bennington is on its way up big time.
The hospital's already partnered with the town. You probably read that news report. The town is now maintaining the baseball field and the soccer field, yes, and eventually the gymnasium. And they'll be open for use this summer, the 2 fields, which have not been used the last 2 years. And they're really nice facilities, and that'll be a great asset to the athletic part of the community as well.
And just to add to that, I was talking to one of our supporters yesterday, a local Bennington person, lovely. And she was saying that they use the trails a lot. And she said, you can't believe how many community members are out there using the trails and how happy people are that they can use the trails, that they know they're safe. It's so beautiful. And people, she said, are just out in droves because they're just so happy that this incredible asset is back to the town. So that's where we are. We hope we can count on your support. We would welcome your support, and it's certainly needed. And anything you can do to help us would be great.
It isn't too late to donate. Even
Nope.
though the drive ended in February, it's still going on. So happy to accept individual or even a club donation if you're inclined. We did have a couple of organizations who donated to us, which we certainly appreciated that. We're happy to take some questions, Mike, from folks if you'd like.
Just mention something real quick. First, thanks, Dave, for taking the role in this. And some of the newer members, Mike McKenna is a member of the Catamount Rotary. Dave Newell was, I think, when did you join? 1980, 1979 or so?
Dinosaurs.
Yeah.
76.
So,
Bird was before
wow.
that. Yeah.
So it just shows you, the power of Rotary and a lot of the community service that I think Dave and Mike have. I mean, it comes from the spirit of Rotary, the 4-way test. So thanks to all of you guys, much appreciated. And I think speak for everyone in saying we're really glad to see that campus revitalized.
Interesting point, Dana. The dorms, not Hunter Hall, but the other smaller dorms, which you saw in Leslie's slide, when they were constructed, that was a Rotary project as well. We helped with that. Ted will remember that, and probably Dean Hansen and some others raised some funds to help construct them for SVC, and that was the first residential buildings that were available on the campus at that time. Probably goes back about 25 years ago.
Mm-hmm. I think you had your hand up a minute ago.
Yeah, I just keep thinking back to Christy Cross's presentation a few weeks ago about our community's social determinants of health, how Bennington County ranks in terms of quality of life statewide. And then I think about this amazing opportunity and keeping those trails open and opening up the athletic fields. And I just, again, want to echo the kudos to you're making an investment to affect that data, right? And love to see that equation. So thank you.
Dean Hansen here. Has there been any discussion or even thoughts about bringing the School of Nursing back now to the college campus?
Great question, Dean. I will tell you that we were in very long discussions with them about that. And actually what's going to happen, Dean, is they're going to go into the Putnam project. They want to be downtown. Castleton wants to bring the School of Nursing to the downtown Putnam project. They feel their students want to live downtown. They want to be downtown, and be in the livelihood of the downtown. So we're very excited about that. And they're very excited about it. So, Castleton's been a great partner. Kevin Daly, who's our Vice President of HR, really was instrumental in working with David, from Southern Vermont College, and of course Tom and others to immediately transition from Southern Vermont College to Castleton. And now we have, I can't remember the amount of nurses that we have enrolled right now. What, Marie, 50 or 60, right? I think it's 50 or 60 students in that.
Yeah. And they'll be living downtown when that phase of the project is done. So that's another just incredible to think of all those students being right downtown Bennington.
And that is impressive, Leslie. I think at the end, we probably had half that many in that program.
Right.
That's great effort.
Yeah, Castleton School of Nursing is excellent. Of course, we've been devastated by the loss of partnership with Southern Vermont College, but Castleton stepped right up. And I want to just for a minute give you, Putnam project phase 1 is almost done. I mean, it's, you're going to see a lot of activity this summer with businesses and a restaurant moving into that space. All those apartments are leased. We have a waiting list, and people that are there love it. Love living there. You are going to see such a catalyst of what's going to happen in the downtown from that project. And when phase 2 happens, we will be leasing space in that phase 2 and bring medical services downtown with more apartments. So it's a game changer. And with this project, oh my goodness, a lot of good momentum.
Wondering what happened to the nursing program that was being established in the old mill on deep north Benmont Avenue. They had the whole, I think the 4th floor was, they had it all refurbished for classrooms and lecture halls. And where is that standing now?
That's where the School of Nursing currently is. Castleton running it out of that building.
Yeah, they have no students there though, right?
Yeah, no, they have students.
Oh,
yeah.
They do?
Yeah,
Good.
Yeah, it's my understanding.
Yeah, the students are there, Jerry. You're right, the build out was actually done by SVC in there.
Right.
on the fourth floor. And it's now leased to Castleton for that program, as Leslie had mentioned. Yeah.
All right. I thought it was suspended due to the virus, the COVID virus, but they're back attending class again. The reason why I asked is because we were all set up to recruit them for Rotaract, and then it shut down. So I don't know. We'll have to go back and recruit their students again for Rotaract.
Yeah, I mean, I can tell you honestly, I don't know what the meeting schedule is. They may have an alternate, many colleges have these alternate, meeting times, only so many kids, that whole probably halftime online. I know Christy's shaking her head. Christy, do you know if is there a combination?
There's, a kind of a hybrid thing happening right now with that. Yeah.
Okay.
Yeah. Quick question on the,
Right. Yeah.
on the dorms, they're pretty one-use type of structure. Do you have any indications yet on what might become of those?
So as I was saying, I think we're looking at possibly retrofitting them for workforce housing. There's a tremendous shortage of housing in this community. I will tell you, one of the silver linings of COVID is that we recruited a tremendous amount of physicians. I mean, we've recruited like 15 physicians in the past year, which is and 4 primary care physicians, which is unheard of for us. Very difficult to recruit physicians, especially primary care, because there are shortage across the nation. But we have recruited some of the most incredible specialty physicians from anesthesiology, GI, orthopedics, pathology, just unbelievable. And when we can get together, we will be doing, we typically have our SVHC Today here in Bennington. We always kick off the season with that and welcome the community to a little presentation of, the status of where we are. And maybe we'll do that, more in the late summer, early fall, when we can safely all be together and have an update so we can share with the community all the great news. But workforce housing is definitely on the table for discussion, as well as childcare. Retrofitting some of those spaces.
Dana, Hunter Hall has got more to it than the other dorms, newer.
Oh, okay.
It was completed in 2012, and it's fully sprinklered. And in addition to the rooms in there, there's a couple different lounges plus a nice atrium known as a Greenberg atrium in there. So there's a little bit more to that one, and some office space as well as the residential rooms.
Yeah, that's a beautiful building.
Any other questions, or anyone want to chime in on anything additional? Christy.
I don't have a question. I just want to kind of say a thank you for SVMC and Dave also participating in this project. A lot of folks don't know, my grandmother was the first graduating class of SVC.
Wow. Oh, great.
My mother graduated from SVC. I graduated from SVC.
Yeah.
Oh, wow.
So it's a big deal.
I didn't know that. Wow.
Thank you.
You may be the only one who can say that. You're a third generation SVC. That's pretty
My
great.
grandmother was an adult learner too.
Well, yeah, if there's any way that we can continue to work, Rotary can continue to work with the SVHC Foundation. Of course, we got one of our district global grants last year when we donated, I think, 5,000 protective masks. That wasn't just Rotary, that was the larger Rotary district and Rotary Foundation. And so that was a great experience working, with Tom, as well as your PR person, whose name is just escaping me right now. I get her emails all the time.
Ashley Jowett.
Yes. Yeah. She was great to work with as well.
Yeah.
And
Yeah, we're blessed. I have a wonderful team. That's my role as Vice President of Corporate Development. We have our foundation and our marketing communications and volunteer services, and we're hoping to bring back our volunteers sometime when we can get the go ahead from the state, but not yet. But we're in good shape though.
yeah, keep thinking of us and how we can help.
Thank you again very much for having us. We really appreciate it. And David, thanks again for all your incredible.
Thanks.